New this morning, we've all heard by now that smoking is not good for our health, but new research shows the harmful effects of cigarettes are actually more dangerous for women.
Yeah, we've been talking about the dangers of smoking in women with CBS 19's Melissa Daigle this morning. Melissa, nowadays, more women than men are actually dying from diseases that are brought on by years and years of smoking.
Yeah, it's pretty amazing. The doctor I spoke with says chronic obstructive pulmonary disease, or COPD, is now the third leading cause of death in women after heart disease and cancer. According to that new research by the American Lung Association, millions of women have symptoms that have gone undiagnosed for years, as we mentioned. Women are now 37% more likely than men to have COPD. And I spoke with a pulmonary care doctor to find out why.
We still see a lot of men, but we're seeing a lot more women.
David Brickey is a pulmonary critical care doctor for Trinity Clinic. He says, unfortunately, he's now seeing women with later stages of COPD.
Where they're more shorter breath. And sometimes that's because I think sometimes women are more stoic and put up with the symptoms.
31-year-old Facia Staples did.
I was having a lot of chest pains.
But this year, she decided to put herself first for her health and her family.
I have two small ones, so I made up my mind to quit so I can be around for my children.
Dr. Brickey says another big reason tobacco hits women harder is because their airways are smaller.
If you get any inflammation or irritation, percentage-wise, there's more symptoms because there's more breath limitation.
He also says tobacco use has increased over the years.
We know since the 60s and 70s, probably due to very creative marketing, that's gone up as well.
He says the hardest and most important thing you can do is break the cycle in your family.
So if you can educate your children and say, kind of do as I say, not as I do type of thing, but also kind of have an approach like this is an important issue, and there's a reason there's warnings on the packages.
Those are lessons 18-year-old Lindsay Harrell was taught at a young age.
My mom definitely did, so she warned me about all the stuff and she laid it out.
Dr. Brickey says you should also encourage exercise in your children.
Our lungs continue to develop till we're 8 years old, so the best thing is engage your children in aerobic activity earlier to build that lung capacity, stay physically active and fit. Those make the biggest differences.
Staples says brisk walking has helped her see those differences in herself.
I've been noticing my lungs been clearing up a lot lately.
She hopes being a positive, healthy role model will help her children make wise choices as they grow up. And Dr. Brickey says exercise is also a great stress reliever to replace with smoking if you've been smoking for stress. He says smoking is not only the worst thing you can do for your lungs, it's also the worst thing you can do for your entire body. Pretty much shows up everywhere after years and years of smoking. Yeah.
So when do parents start talking to their kids about the dangers of smoking?
Well, I asked Dr. Brickey that, and he said it's actually okay to do it before middle school even, because their teen years, they're often facing a little bit of peer pressure there. So yeah, at a young age is perfectly fine.
It's hard to see at that age what the kind of results are later in life. So good to have that discussion early on. Yeah. All right, thanks, Melissa.
Thanks, Melissa. Well, according to the American Lung Association's new report, the number of deaths in women from COPD has more than quadrupled since 1980.
Yeah, right now more than 550,000 women in Texas are suffering from the disease. Compare that to about 440,000 men in our state.